your question. Right, so if you have read and understood, considering it history-taking session, kindly begin.
Hello. Hello. Good morning. I'm Dr. Mo, one of the surgical and one of the doctors here in A&E department. So I've got a letter from GP that you have taken excess doses of your medicines. Is that right?
Yes, it is correct.
Can I also confirm your name and age, please?
My name is Jacob, 67 years.
Jack, 67. All right, Jack. So apart from this problem, is there anything that I can help you with?
Yes, sure.
So how can I help
my
you?
problem, doctor, I've always confused and my mood is very low and I'm very irritable. Even I do not want to talk to any doctor, anyone else.
Oh, I'm so sorry, Jack. When did this happen?
It is for many months. It is this problem is with me.
Both mood problem and being irritable?
Yes, I am irritable most of the day.
Okay, so
I do not want to talk with people. People's talking irritate me.
I'm sorry to hear that, Jack. So about the mood, do you think that it is getting worse these months?
What are you saying?
Do you think your mood is getting worse over few months?
Yes,
since
yes.
started?
It is getting more worse. I am going antisocial day by day. I do not want to meet.
And then, do you feel that your mood is very low throughout the day?
No, it is mostly in the morning, daytime, morning.
Does it vary throughout the day, or is it just in the morning?
Yes, with the passing day, it improves.
Okay, that's good to hear. And then, do you feel like you are no longer enjoying life anymore?
Yes, I have no interest with life entertainments and other activities.
Do you feel like you're overly tired?
Yes, I feel lethargic, fatigue.
Right. How about your appetite? Are you able to eat and drink well?
No, my appetite is decreased nowadays for several weeks.
Do you notice any loss of weight as well?
I did not check my weight.
Okay. How about your sleeping? Are you able to sleep well at night?
No. I have difficulty in falling in sleep because I have so many thoughts and my sleep is decreased.
Do you have you ever felt like you wake up at night and have problem with sleeping again?
Yes, several times.
All right. So yeah, we're trying to find out what is causing this problem with the history-taking examination. All right. We also involve other specialist doctors in your case to find out.
Yes.
Okay. So the next question will be quite personal to you, and that this discussion will be confidential. Are you okay to proceed with this?
Yes, sure.
Okay. So how about your sexual drive?
It is decreased. It is decreased.
Okay, I'm sorry. I'm really sorry to hear that. And then do you feel like you have loss of interest or concentration these days?
Yes, yes, sure,
Mm.
right.
Have you ever thought of harming yourself?
What are you saying?
Have you ever thought of harming yourself or others?
Sometimes
Oh,
I feel.
that sounds really serious for you. Yeah, we're trying to fix this problem as soon as possible as we find out what's causing. All right, Joe. Then do you feel like your mood is very low when sometime, and then you feel very elated at some point?
Yes, yes, but mostly mood is in daytime or in the morning it is low.
Mm. And do you also feel you are seeing or hearing things that are difficult to be explained?
So yes, yes.
Okay. How about relationship with your family or friends? You mentioned you are feeling antisocial.
Yes, I reluctant to meet other people because their talking irritate me, and I'm further my mood is going low.
Yeah, that must be really hard for you. Okay. Do you have any previous problem with your mental health?
No,
Have you had any counseling sessions before?
yes, sometimes counseling session was there.
Have you been hospitalized for any mental health?
No, no.
Okay. So the next question will be about your medical history. Do you have any medical problems?
Yes,
Diabetes, hypertension?
I have several problems. My blood pressure is increased. I have sugar problem, and my lipid in the blood is high. So I'm taking for 15 years these medication. I'm so tired of these things,
Oh,
of taking so much medicine.
yeah, that must be really difficult for you. Do you have any surgery done before?
No, no.
Okay, can you summarize your history taking now, please?
So if at the time of appointment, I will ask her personal history, alcohol, personal history, social history. And then, so I just took a history from the 67-year-old man who presented with low mood for several months, which is getting worse, which it is also associated with being irritable. He has major depressive symptoms as well as major depressive symptoms, and then he has history of thinking about self-harming and self-harming as so he has a medical history of diabetes, hypertension, hypercholesterolemia, more than 15 years. So my
Okay.
provisional diagnosis is depression, but severe depression. I will also consider other causes such as schizophrenia, bipolar disorder.
All right. How would you confirm your diagnosis?
To confirm this, I will consult with liaise with this patient with a psychologist.
Okay, and
For the management plan for severe case, he will need intensive psychosocial intervention. For the medications, SSRI might be required. Since he has thought of potential of harming himself or others, he could be hospitalized with using mental health act.
okay. What is the management that you'll suggest for this patient?
Actually, do the things I said, the management for him.
Yeah, but I asked you, how would you confirm your diagnosis? Would you go out for any investigations, any blood tests, anything? Because if you consider bipolar or schizophrenia as your differential diagnosis, I'm sure you must do some lab work as well. And what should be the treatment?
Actually, I don't know how to investigate this patient.
The differential diagnosis, the provisional diagnosis you told me, just think of that and tell me from your own common sense. Because in scenarios, sometimes in exam as well, the stem would not come word by word. They might change one or two words. In the STEM, in exam, patient is feeling depressive after gastrectomy has been done. But here, my patient is different. So scenario has been modified little bit. So you tell me according to what you think. Others can help you as well. Yes. When she was,
can start with routine
Yes.
blood test.
yes,
As he is confused, we can do serum creatinine, urea,
yes,
and if you think of any cerebral things, you can do some CT scan of the brain or MRI.
yes, to rule
And
out all the organic causes.
rule out.
Yes,
As it is a depressive symptom, so it is a diagnosis of exclusion. That means you have to exclude everything to come out to this diagnosis of depressive illness.
yes. Another thing I want to point out, patient is 67 years old and patient has mistakenly taken, overdosed himself 4 times. Could there be a cause of dementia or Alzheimer or something more organic?
Yeah,
So-
so if we do this CT scan of the brain, then we
Yes.
can see the ischemia of the cortical
Yes.
regions of the brain.
Very good. Yes, that can be ruled out. So this is one organic differential,
Yeah.
1 or 2 that you can easily rule out by doing the CT brain. So these are the investigations, and blood tests you'll also do, routine blood tests you'll send. Because
Yeah.
patient 1 is already hypertensive and diabetic. Could there be that patient is continuously staying in a hypoglycemic level? That's why patient is confused and patient is not thinking clear, because the medications that patient is taking for diabetes, that has resulted in uncontrolled diabetes. So uncontrolled hypoglycemic events are happening. Patient is confused. So think of the organic causes that you can put in differentials and you can rule them out. Yes.
Yes,
Anything
ma'am.
here they have in depression, they have they've written like they'll classified it according to mild and moderate and severe, and they have written the management according to it, that if it rules out to be depression, then first they'll put the lifestyle modification in the form of regular exercise. Then they'll advise the patient for psychosocial therapy, cognitive behavioral therapy. Then if it finds out to be moderate to severe depression, then they'll introduce even the medications like SSRI in addition to CBT and exercise. Right. So, and if patient, like you said, patient can be a threat to himself, then according to the Mental Health Act, patient can be hospitalized as well in the psychiatric ward. So what is Mental Health Act? What is it? What freedom or what responsibilities comes on you as a surgeon or as a physician once you know that patient is under Mental Health Act? What can you do for the betterment of patient? Anyone going for exam can answer? Yes.